Welcome to this video entitled, Pharmacotherapy of Peptic Ulcer Disease. Hugh Marshall is a 71-year-old man who has been taking ibuprofen, marketed as Motrin, for a shoulder injury and assumed that this was the cause of his stomach pain. He is a one-pack per day smoker and drinks 1 glass of wine every night with dinner. His medical history includes hypertension, for which he takes a combination diuretic and angiotensin-converting enzyme inhibitor. He stopped taking his ibuprofen, but the stomach pain did not subside. Because of worsening symptoms, an endoscopy was performed, which confirmed the presence of Helicobacter pylori. He is worried about taking antibiotics because he has been allergic to penicillin in the past. Question 1 reads, based on the scenario, what risk factors for peptic ulcer disease does Hugh have? Risk factors for the development of peptic ulcer disease include infection with Helicobacter pylori, use of non-steroidal anti-inflammatory drugs, including ibuprofen or aspirin, smoking tobacco, alcohol use, serious illness, and genetic factors. Question 2. How would you, as the nurse, describe the recommended treatment for Helicobacter pylori-induced peptic ulcer disease to him? Antibiotics are used to eradicate Helicobacter pylori. Although Hugh is allergic to penicillin, other combinations of drugs to eradicate Helicobacter pylori are available. These may include combinations of the following: clarithromycin, marketed as Biaxin, tetracycline, metronidazole, marketed as Flagyl, and bismuth compounds. A proton pump inhibitor, which may further decrease bacterial load and suppress acid, also may be prescribed. Client adherence is necessary to eradicate the organism. Clients must understand that they must complete the antibiotic regimen to fully treat the peptic ulcer and combat antibiotic resistance. They should be advised of adverse effects, including nausea, diarrhea, and headache. Question 3 reads, why would you be concerned about this client with a history of hypertension using non-steroidal anti-inflammatory drugs? In some clients with hypertension, the use of non-steroidal anti-inflammatory drugs has been shown to worsen the effects of hypertension. The chief mechanism by which non-steroidal anti-inflammatory drugs contribute to hypertension and decrease the effectiveness of antihypertensive drugs appears to be the inhibition of prostaglandin synthesis. This inhibition results in an increase in sodium reabsorption and water retention. We will now progress to the MCQs. Question 1 reads, the client has developed severe diarrhea following 4 days of self-administered antacid preparation. The nurse suspects that the diarrhea may have been caused by which type of antacid? A. Aluminum compounds. Or B. Magnesium compounds. Or C. Calcium compounds. Or is it D. Sodium compounds? The correct answer is B, and the rationale is magnesium compounds, especially in higher doses, often cause diarrhea. Options A, C, and D are incorrect. Aluminum compounds and calcium compounds may cause constipation. Sodium compounds may cause flatulence. Question 2 reads, omeprazole, marketed as Losec, is prescribed for a client with gastroesophageal reflux disease. The nurse will monitor for a reduction in which symptom to determine if the drug therapy is effective. Select all that apply. Is it A. Dysphagia? Or B. Dyspepsia? Or C. Appetite? Or D. Nausea? Or is it E. Belching? The correct answers are A. B, D, and E, and the rationale is. Symptoms of gastroesophageal reflux disease include dysphagia, dyspepsia, nausea, belching, heartburn, and chest pain. Option C is incorrect. The nurse would not expect a decrease in the client's appetite due to this medication. Question 3 reads, a nurse is scheduling her client's daily medication. When would be the most appropriate time for the client to receive proton pump inhibitors? Would it be A, at night, or B, after fasting at least 2 hours, or C, about half an hour before a meal, or would it be D, about 2 to 3 hours after eating? The correct answer is C, and the rationale is. The proton pump is activated by food intake. Therefore, administering it about 20 to 30 minutes before the first major meal of the day allows peak serum levels to coincide with when the maximum levels of pumps are activated, allowing maximum efficiency of the proton pump inhibitor. Options A, B, and D are incorrect. The proton pumps are less active at night, in the fasting state, or between meals. Question 4 reads, a client who has duodenal ulcers is receiving long-term therapy with ranitidine, marketed as Zantac. The nurse includes in the care plan that the client should be monitored for which adverse effects. Is it A, photophobia and skin irritations, or B, neutropenia and thrombocytopenia, or C, dyspnea and productive coughing, or is it D, urinary hesitation and fluid retention? The correct answer is B, and the rationale is. Blood dyscrasias have been reported, especially neutropenia and thrombocytopenia, with long-term use. Periodic blood counts should be performed. Options A, C, and D are incorrect. Ranitidine, marketed as Zantac, does not cause photophobia and skin irritations. Dyspnea and productive cough are not expected adverse effects for this medication. Ranitidine is not known to cause these symptoms. Question 5 reads, a nurse is caring for a client with gastroesophageal reflux disease should question the order for which drug. Is it A, H2 receptor antagonists, or B, proton pump inhibitors, or C, antibiotics, or is it D, antacids? The correct answer is C, and the rationale is. Antibiotics have no role in the treatment of gastroesophageal reflux disease, although certain antibiotics are used in treating peptic ulcer disease to eradicate the Helicobacter pylori organism. Options A, B, and D are incorrect. H2 receptor antagonists and proton pump inhibitors are used routinely to relieve symptoms of gastroesophageal reflux disease. Over-the-counter antacids provide intermittent relief for mild cases. Thank you.